Hello, ladies, and welcome to this episode of the Autoimmune Rehab Podcast, where, as always, you can find show notes and listen to all of the past previous episodes at autoimmunerehab.com or search Autoimmune Rehab at your favorite podcast player. Welcome to today's episode, but with no further ado, let's welcome our host, Anna Laura Brown, who, as their tagline on our social media site says, is a health coach, essential oils educator, podcast host, author, dog lover, and avocado lover. And yes, it's true that dogs and avocados are really two of my most favorite things. May seem a little random, but it's true. With no further ado, welcome, ladies, to this episode of the Autoimmune Rehab Podcast, and let's get started. So for today's episode, we have a little bit of a kind of a different one in the sense that I am going to talk with you about a medical treatment that I received last year. In fact, the day that this podcast is going up is actually going to be the 1-year anniversary of the day that I got this treatment. And I'm going to share with you a little bit about what it is, why it's being done in the medical field, and what it has done for me over the past year, and just a little bit of other hints and tips and tricks and things for you to know. And if you've read the title, which I'm assuming if you're listening to this, you paid attention to the title a little bit, you know that what we're going to be talking about is what is known as PRP, or otherwise platelet rich plasma. And typically, a little bit of a background on what this is. So platelet rich plasma is where you go into a doctor's office, and typically it's in orthopedics. In some cases, there might be other kinds of doctors offering it. Like I have seen recently ads online where there are like skincare nurses and things offering it as well for different, probably youth rejuvenation and things like that. But generally speaking, it's the most known and the most studied in the medical field in orthopedics. So in case you weren't aware, I had knee surgery in March of 2022. No, it was not a replacement, and I'm trying to avoid doing knee replacements, which I will discuss later on in this podcast, why I'm not going to be doing knee replacements, or at least if I do them, I won't be doing them for at least another 20 or 30 years. When I'm much older, I'm only in my 40s now, and I don't believe that doing knee replacements in your 40s is a good idea, and neither does my orthopedic. So what I am talking about then here with this platelet-rich plasma injections. So what happens is you go in and they have a phlebotomist that draws your blood like you would like a normal blood draw, like for a routine physical or whatever. And then you have to wait for about an hour while they separate out your blood into the platelets. And I believe there's also I don't know, I'm not an expert in it. Your white blood cells, your red blood cells, and your platelets, I believe. Anyhow, I just remember seeing that there were 3 tubes of injections that they had there on the table. And then what happens is the orthopedic, or doesn't necessarily have to be an orthopedic, could be like a nurse practitioner or a PA, or anybody who's really got the training and licensing in it could do it. But in my case, it was actually the orthopedic who also did my surgery. So I feel like really blessed that way, because a lot of times these treatments are sometimes offered at other places and not always where your orthopedic surgeon actually offered them. But my actual orthopedic surgeon did it. And they take him and they cannot numb you at all or give you any kind of medication. And so it can be really super painful. And for me, it was very painful. Personally, I have never had children, but sorry, got to take a drink of water there. Mother said that I acted like I was in so much pain. It was like I was birthing a baby without having any medication or anything. So it was very, very painful. Probably one of, if not the most painful things I've endured. And granted, that pain only lasted for about 3 minutes. And then it started to come down. And after they did those injections, they had a little bit of the plasma left. So they asked me if I had another spot that was bugging me. And I've had low back pain for a lot of years. So they actually put it into my lower back. And so that is what happened with the actual plasma treatments. Now, let me talk with you a little bit more, and then I'll come back and share where I'm at a year later. So the actual official definition of what PRP is platelet-rich plasma therapy. It's a medical treatment that uses a patient's own blood to stimulate healing in injured tissues. So like I said, they draw your blood out, they spin it around, and then they re-inject them back into your body. So, in case you weren't aware, platelets are the small cells in our blood that are responsible for clotting and promoting healing. So, by injecting a concentrated amount of these platelets back into the patient's body, it is thought that the healing process can be accelerated and enhanced. And it's also part of a larger category of what is known as regenerative medicine. And it can be done in two different ways. So some orthopedics will do it after surgery on a patient, like in my case, where I had it done after my knee surgery. My knee surgery was in March, then my platelet rich plasma injections were in May. Or sometimes they will do it before surgery as a way to try to avoid surgery. So some of the kinds of things that PRP can be used for was used to help with chronic tendon injuries, osteoarthritis, can help with tears and strains in muscles and other things like that. And excuse me there, it's like I've got a frog in my throat to drink a little bit more water. Probably should have done that before I started recording, but I'm one of those people that likes to just record and not do a lot of editing. And hopefully things are still okay. I'm just going to drink a little more water here. So I'm just going to talk through this, just be real. Okay, so like I said, there's few reported side effects. And so it's, in my opinion, really an amazing thing when you think about it, that you can harness the power of your body's own blood to help heal you. That's just not a concept that I think a lot of us are familiar with, nor is it something that a lot of us think about. So then back a little bit to my experience. So I know that different orthopedics and doctors have different ways of doing it, but my particular orthopedic is very adamant that you cannot have any ibuprofen, Tylenol, or over-the-counter pain meds for a minimum of 6 weeks after you do this treatment. And for some people that may be difficult. For me, it wasn't a big deal because I only take ibuprofen maybe a couple times a year. I personally have found more effective solutions like polyphenols. Take a polyphenol supplement, copaiba, turmeric, clove, some of these kinds of things to help alleviate different kinds of tension and discomfort and pain that I may be experiencing. And I will link to some of these things in the show notes in the description. But the point is, I don't take a lot of ibuprofen anyway, so for me it wasn't a big deal. But this is something that if you are researching PRP or platelet-rich plasma injections, this is something you want to be aware of going in. And I've been known for quite some time that ibuprofen was not good for you. And previously, when I was younger, before I really got into holistic health and healing, started studying and learning about essential oils, I was not one of those people who would shy away. I literally would take ibuprofen maybe 4 or 5 times a day. And I realize now how bad that was for my health. So I know this is a little bit of a side note, but I feel like it's important to mention the fact that my doctors were telling me after these injections that I absolutely could not touch it for 6 weeks at least, or it may not, the blood may not, with the plasma in my needs may not work to the effectiveness that I had hoped for. That really sent me on a journey and a sense of discovery that it's really, really bad for you. So that's something just to think about. I actually made it personally about 8 weeks before I had to succumb and take one, because I actually got COVID and then also got menstrual cramps at the same time. That was fun, I'm telling you. Yeah, not really. You get the picture. But anyhow, so flash forward to, like I said, this podcast is coming out on the 1-year anniversary of the day that I got those plasma injections. I have to tell you, it has made a big difference. The surgery initially really helped too, because it helped to repair a lot of the damage that I had, and my knee damage is pretty substantial. In fact, both knees really, I'm not to the point of being bone on bone yet. Fortunately, I caught it in time, but my cartilage and things is pretty severely damaged. I had pretty severe arthritis in both knees, that kind of thing. And so I feel like doing the surgery first was helpful and necessary. And in fact, when I came home from the hospital for my surgery, I had had such immense chronic knee and leg pain that I hurt less after surgery than I did before, which is really saying a lot, because surgery, sometimes can increase your pain, but it actually decreased my pain right away. And 2 months later, when I did the plasma injections, I was already starting to feel like I was getting some healing and stuff. But what the plasma injections did for me is it stepped in and started working to help repair some of the damage to my knees. It hasn't repaired all the damage, and it's not going to, and that's why I'm going to have to do stem cells. But like I said, I will get to that in just another minute here. But it has helped substantially. It has reduced my pain levels to the point that I can, sometimes if I get a little pain, take a little pill of turmeric or something, or rub a little bit of an essential oil thing on my knee, and I'm good. I don't experience, it's more like that moderate tension and stiffness, if you will. It's not the massive swelling and chronic pain that I had before, thank goodness. So it has definitely helped. And the other thing that's been really great for me is it's probably been at least 3 years, maybe more like 5 years, since the last time I could get down on my knees and deal around. So if I dropped a pin on the floor before, I couldn't get down and pick it up because I would just be in too much excruciating pain. And it was also really physically hard for me to even do what it took to even get down on my knees. And so that has been really, really amazing as well. So I'm looking forward, to continuing to see what happens in about the next year before I go to stem cells. I was given a time frame of having to do it. I have to wait at least 1 year. So now this podcast is out, I'm eligible to do stem cells. But, due to the cost, I'm probably going to wait 1 more year, but I can't wait more than 2 years because of the damage to my knees. I really need to take action and do them sooner rather than later so that I can avoid having to do knee replacements. And like I mentioned at the beginning of this podcast, I've definitely talked to some people who think I'm nuts for not just doing knee replacements. But the reality is that there are some pretty big risks with them. And a lot of times knee replacements don't last forever. So, you do your knee replacements in your 40s, you're going to be doing them again at least a second time and maybe a third time. And as I hinted on when I was talking about the PRP, one of the advantages to stem cells is that you, just like the PRP, you can exert it into multiple parts of your body. So my orthopedic has actually even said that I may even go into complete full remission from my thyroid and Hashimoto's issues and be able to possibly not even take my thyroid medication after I do stem cells because of the effect that it will have on my entire body and not just my knees. And of course, they're able to, and I probably will have them do this, put a little bit into my lower back. If I have a shoulder that's bugging me, they can put some there. They can just, insert it throughout multiple parts of your body. And you're not exerting yourself into a really extensive surgery that's going to take, in my case, both knees, I'm looking at least 6 months of recovery. So, that's just not something I want to do. Plus the costs, even with insurance, it'll cost me about the same, quite frankly, with the insurance costs and physical therapy and things like that. So I'm just not interested in putting my body through that and then taking that time recovery. And I feel like stem cells have come a long way in the last little bit. So, if you researched stem cells years ago, you may not have gotten the same information that you would today. And my orthopedic has become a very big expert. He's been researching and working on stem cells for the last 10 years, so much so that it would not surprise me if he ends up winning some sort of science or medical award for his contributions to medicine in the field of stem cells and regenerative medicine, because he's really into it. And in fact, actually only does surgery on about 20% of his patients now. So, yay, go me. I was one of those 20% that had to have surgery. But, it is what it is. So anyhow, just wanted to share this with you. Like I said, if you found this podcast because you are researching the platelet rich plasma, if you have any questions and would like to know more about it, feel free to reach out to me. I do have some presentations and scientific stuff that I could send you. Also, of course, I can send you to my orthopedics clinic as well to explore if it's a good fit for you in your medical situation. And take care. Thanks for listening. And I look forward to sharing with you soon on another episode of the Autoimmune Rehab Podcast. And if you've liked this enjoyed this episode, please leave a review, rate the podcast, share it with other people. Also would like to invite you, if you haven't already, to join my email list by grabbing your copy of my free 30-day self-care journal template that you can download from AnnalauraBrown.com. So that's ANNALauraBrown.com/self-care. And of course, the link will also be in the show notes for that as well. Take care again, and I will join you soon next Saturday on another episode of the Autoimmune Rehab Podcast.